Hi, my name is Taylor with Valor Medical Solutions, and I'm going to be showing you how to set up your cardiac at-home rehab through ROMtherapy. You're going to be given a couple of different things. You're going to have the ROMTech bike itself, and you're going to have your cardiac patient hub. Your cardiac hub is going to have all of the essential equipment that you're going to be using during a session with your cardiac rehab specialist. The hub itself is going to charge all of your equipment that you will be wearing during a session. Your equipment is going to include your blood pressure cuff, your EKG, your pulse ox, and your adhesives to keep your EKG in place. When you're ready to start a session and your cardiac rehab specialist has called, you're going to go ahead and put your equipment on. The blood pressure cuff is going to go on the left arm. You're going to have the up and down symbols. And make sure the up and the down is on the inside of the arm. Perfect. And your pulse ox can go on either wrist. You're going to take it, put it on nice and snug. And then the pulse ox is going to go over the thumbnail, not any other fingernails. It's going to be the thumbnail. And it's going to go right on top, just like that. And then last but not least is going to be your EKG reader. Your EKG reader itself is reusable. You will make sure not to throw this away. Instead, you're going to use the EKG adhesives to keep it in place. Your pack should have 3 to 4 in each pack. On the device side, you're going to have the number 1. You're going to take off the number 1, and you're going to see 3 large circles on the inside. On the back of your EKG, there's going to be 3 large circles. You want to try to line the circles up as best as you possibly can. And then once this is on, you'll go ahead and take off the 2 tab, which this is going to be the adhesive side, which will stick to the skin. When placing the EKG patch on, you want to make sure that the 3 hearts are facing up, and you're going to go ahead and place it on the left chest diagonal. You want to make sure when you have it on that the hearts are facing up and the adhesive in the EKG is slanted downward on the left chest. Once everything is in place, you're going to go ahead and get started on your session. Your cardiac rehab specialist is going to come onto the PC and they're going to talk you through a session. On your phone, this is where all of your data will be stored. As you can see all of her data being placed at the moment. You have her pulse, her respiratory rate, her body temperature, and then your BP, your blood pressure cuff, will be manual. And as that starts to go, you will get that data as well. And as you do each session, your data will be stored and it will be sent to your cardiac rehab specialist and your cardiologist. After each session, your cardiac rehab specialist is going to sign off, and then it's time for you to go ahead and place all of your equipment back in the cardiac hub to charge. The blood pressure cuff is going to be taken off and slid back down. Make sure to put it back on the Velcro so we don't get any dirt in there. To charge the cardiac hub, there is a spot right here and a charger right next to it. You're going to go ahead and plug it in, and you'll see a little battery icon pop up. This is going to be placed right here in the box. Then you're going to go ahead and take off the pulse ox. The watch itself will be charged. The pulse meter will not. It has a little spindle top right here. You can place it down. And then the watch actually has a little holder and a stand where you're also going to plug it in right here. And then last, we're gonna go ahead and take off the EKG. And then, like I said, we always wanna make sure that we throw away the adhesive, but we're keeping the EKG. Throw away, keep. To charge the EKG, you wanna make sure that you position it correctly or it will not pick up a charge. On the inside, you're gonna have your EKG charger, which is a little placement holder for it. You're gonna have these two small circles that need to line up with the two small nodes at the bottom left. When you plug it in and you close it, you'll see a light come on. When this light comes on, that is how you know that it's being charged. Once you have everything in the box charging, you can go ahead and close the box if you'd like, or you can keep it open, but just make sure that it is always plugged into an outlet, so when you are ready to start a session with your rehab specialist, it's all charged and ready to go. Last thing you're gonna charge is gonna be the phone. You're gonna go ahead and take the phone out of the holder. The charger is going to be the one at the very bottom. And then you're all ready to go. And once your cardiac rehab specialist schedules your next session, you'll have everything charged. You'll put it on just the same way and take it off the same way as well. If you have any problems with your equipment, let your cardiac rehab specialist know or give us a call. Thank you so much.